Kidney failure, sometimes called end-stage renal disease, or ESRD, is a symptom that kidneys lose partial or whole function of filtering the blood. It is usually diagnosed and treated by nephrologists or urologists. Kidney failure can be divided into two parts, which are chronic kidney disease, or CKD, and acute kidney injury, or AKI.
CKD is a condition that one's kidney function slowly getting worse over a period of time. The damage is usually caused by other health problems that has done permanent damage to the kidney. In the late stages of CKD, as the patient is nearing kidney failure, one may notice symptoms that are caused by waste and extra fluid building up in their body.
In recent years, the two main causes of chronic kidney disease are diabetes and high blood pressure, which are responsible for up to 2/3 of the cases. Kidney damage from diabetes is called diabetic nephropathy. The third main cause is glomerular nephritis. This condition changes the renal physiology, particularly how the glomerula filters the blood. Inherited disease such as polycystic kidney disease could also cause CKD. The symptoms include itching, muscle cramps, nausea and vomiting, not feeling hungry, swelling in your feet and ankles, not enough urine or too much urine, have trouble catching your breath.
CKD is divided into 5 stages. Depends on the complications from other health conditions. The amount of time needed to reach the final stage, which is the 5th stage, varies from 3 months to years. Severity increases over time. Kidney functions decreases as damage accumulates. Stage 1 represents having normal healthy kidney functions, but with other health issues that have yet to show any CKD symptoms. From stage 1 to 5, an increasing amount of protein starts to appear in the urine, and fatigue kicks in, and a normal amount of fluid starts to accumulate throughout the body, which is called edema. Protein, potassium, and sodium intake must be regulated, and starting from stage 4, the patient needs dialysis to sustain normal body function.
Acute kidney injury, also known as acute kidney failure, is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. During the episode, the kidney suddenly loses the ability to eliminate excess cells, fluid, and waste materials from the blood, causing a buildup of waste products in your blood and make it hard for your kidneys to keep the right balance of fluid in your body. AKI can also affect the other organs such as brains, heart, and lungs. AKI is common in patients who are in the hospital, in intensive care units, and especially in older adults.
AKI can occur for many reasons. Among the most common ones are decreased blood flow, direct damage to the kidneys, and blockage of the urinary tract. Decreased blood flow can be caused by hypotension, heart attack, and other use of pain medicines, such as ketamine can damage bladder and lead to bladder atrophy. So urine may countercurrent back to kidney. Visco-ureteral reflux causes hydronephrosis. Direct damage to the kidney includes acute tubular necrosis, or ATN, glomerulonephritis, and other inflammation that affects the filtering units. Lastly, Nephrolithiasis and blood clots in urinary tract can also trigger AKI. Symptoms are the following: too little urine left the body, swelling in legs, ankle, and around the eyes, fatigue or tiredness, shortness of breath, confusion, nausea, seizures or coma in severe cases, chest pain or pressure.
In some cases of acute kidney injury, dialysis may only be needed until the recovery of the kidney. However, when chronic kidney disease develops into a serious condition, the kidney would not get better anymore, and the patient would have to undergo dialysis for the rest of their life, unless receiving a kidney transplant.
Dialysis can replace the function of kidneys when people have only under 15% of kidney function. And there are two kinds of them: hemodialysis and peritoneal dialysis. In hemodialysis, your blood is pumped out from your arm and goes through a dialyzer and filtered through an artificial semi-permeable membrane. While in peritoneal dialysis, a dialysate goes right into your abdomen and uses your peritoneum as a natural semi-permeable membrane to remove the waste extra ions from your body.
Another major difference between hemodialysis and peritoneal dialysis is the feasibility and convenience. Hemodialysis usually takes 3 times a week, and each session lasts about 3 to 5 hours. It is often carried out at a hospital with a rigid schedule and tighter restriction. For peritoneal dialysis, it can be done by patients at home with 4 to 6 times a day, each lasting 30 minutes. Patients can have higher quality of life because the equipment is relatively small and portable. Peritoneal dialysis can maintain better function of kidney and has less impact on cardiovascular system. However, since peritoneal dialysis is not operated by medical worker, it has the risk of peritonitis.
A good dietary habit is beneficial to the kidney. Limiting consumption of oil, salt, and sugar is a good way to reduce the burden of kidney. For the patient undergoing peritoneal dialysis, it is important to have sufficient exercise and supply enough protein. Phosphorus are limited to both hemodialysis and peritoneal dialysis patients. Last but not least, do not misuse drugs or take unknown medicine. They may seem harmless but still take its toll on the kidney.